Hello, I'm Dr. Rogers Wilson, the Acting Chief Medical Officer at the Arizona Department of Health, Division of Behavioral Health. As many of you know, state budget reductions have resulted in significant changes in our behavioral health system. One of these changes affects our medication benefits package, which no longer covers brand name medications for non-Title 19 members with serious mental illness, also known as SMI, beginning on July 1st, 2010. During the past several weeks, we have closely observed the transition of our members from brand name medications to generic medications. When the change from brand name to generic medication was announced in early May, most members were provided with a 30 to 60-day transition period. Even though this time frame was adequate for most members, we recognize that other members may need more time to safely make the transition, especially members taking atypical antipsychotic medications. While we cannot reverse decision to no longer cover brand name medications, we recognize that our decision must be flexible and take into account the unique clinical needs of each person in our system. Therefore, we have designed a prior authorization process that will offer an option to extend for a limited period of time the transition period to members after July 1, 2010. The transition period may be extended using the prior authorization process to, number one, those non-Title 1921 SMI members enrolled as of June 30th, 2010, who are currently taking brand name medications, who have not yet been successfully transitioned to an alternative generic medication because of clinical and safety concerns, and who do not currently have an alternative payment source for brand name medications, but have a realistic option of finding a third-party payment source within the transition period. Number two, those non-1921 SMI members previously eligible for Title 19 enrolled after July 1st, 2010, who have been taking brand name medications, who have clinical safety concerns related to an abrupt discontinuation of brand name medication and transition to an alternative generic medications, and who do not currently have an alternative payment source for brand name medications, but have a realistic option of finding a third-party payment source within the transition period. This prior authorization process intended for the sole purpose of transitioning non-Title 19 members from brand name to generic medication in the safest and the most clinically appropriate manner. It should not be considered an exception to the reduced medication benefit, as this option is only temporary and under specific circumstances. We intend to monitor the prior authorization process to document time extensions, and time extensions have to be based on clinical need. The prior authorization process will have strict limitations. REBAs will be permitted to approve an extension on a case-by-case basis in 30-day increments, not to exceed a total of 90 days of coverage period within a 12-month period for individual per medication. A new guidelines document is available online that explains this process in more detail. We appreciate all of your support and suggestions from our members and providers during these challenging times, and welcome your comments and feedback. You have our promise that we will make every decision to implement the budget reductions to maintain the highest quality of care as being our #1 priority. If you have any questions about the benefit guidelines or this prior authorization process, please contact your local regional behavioral health authority or call us at 602-364-4558. Thank you.